A couple of weeks ago, we heard on the radio, on our news cycle, that there had been a groundbreaking surgery performed right here in Indiana, and Dr. Trale performed that surgery. Dr. Maliver, you're with Antria, which is a company that is, well, it's making amazing inroads all across the medical industry. Let's start with you this morning. Antria was the spearhead for this surgery.
Yes, Antria originally started out as a stem cell research company, and over the years we've kind of morphed into a site management organization. We still do stem cell work, but now we're doing research for other companies. And because we have a background in stem cell research, we've garnered work from other stem cell companies, and that's how we made the connection for this study that we just did.
Okay, and this was a clinical study that resulted in this surgery.
So this is a phase 3 study for a off-the-shelf placental-derived stem cell product that is being tested for use with bipolar hip replacements. Mm-hmm. Basically, what's happening is we're finding a very high mortality and morbidity rate with this kind of operation, and so various researchers are looking for different ways to improve the results of this surgery. And what we found is that by using stem cells to help the healing after the surgery, these patients are going on to recover much quicker and having a much lower morbidity and mortality rate.
That doesn't happen just by chance that you find these things out. It's not something that you just happened upon. There has to be research that leads you to make that conclusion that this could be the solution.
So the company that we're working for has done a lot of research and has done a lot of other studies in Europe and the Orient, and they've had excellent results. And that's how they were able to present these results to the FDA of the United States and get approval to go ahead and do the research here in America.
Dr. Brandon Trale, you did that surgery, and the patient, 83 years of age, is that a typical patient for this type of surgery?
Absolutely. The typical patient that receives a partial hip replacement, which is the bipolar hemiarthroplasty, is an elderly patient that sustains a fall and gets a femoral neck fracture. The reason we have to do a partial hip replacement is because the blood supply to the femoral head is disrupted with this type of fracture, and even if you tried to put it back together with screws and or hardware, the femoral head would necrose and die and collapse, and it would present a need for further surgery.
Yeah, so that's something that is a common type of thing, and particularly in someone of that age. When you learned about the possibility of doing this surgery, working with Antria, what was your reaction?
I was thrilled. It's great to be a part of groundbreaking research, and to bring it to a small town like Indiana. A lot of people don't realize what Indiana has to offer, as far as our small company and the hospital and other things in the region here.
So you were able to get the gentleman on the table, and you're able to perform the surgery. Where does the stem cell, where does that come in?
We do. There are several different approaches to the hips, surgical approaches. This particular study required that we do a direct lateral approach to the hip. So we get the patient on the table, we do the approach, we put the implants in, we reduce the new hip, and then as we close, there are layers of tissue that you have to close as you move from inside of the hip to the outside. And when we get to the muscle layer, that's a crucial layer because muscle doesn't heal as well as other tissues. And the object behind the study is to see whether or not when we inject these stem cells on either side of the muscle closure, if the patient has improved results post-operatively.
And so you're basically just folding that tissue back over, and then that's where the injections come in?
The tissue is sutured together. So we actually stitch the tissue back together, and then we put the stem cells on either side of the closure.
Mm-hmm. This was done how long ago?
This was done about 4 weeks ago.
4 weeks?
Yeah.
Yeah, and obviously there has to be a lot of monitoring afterwards to find out how it is going and whether this is actually going to be something that is going to become a norm.
Absolutely. This is a randomized controlled double-blind study. So what that means is the patients are randomized into two groups, and we are blinded and the patients are blinded as to what they are actually getting. So they either get the stem cells or they get a placebo. And that's how we can tell if the stem cells actually give us favorable results postoperatively. Postoperatively, the patients are monitored for their function, their ability to walk, their ability to climb steps, and they are also, the muscle is ultrasounded and measured. So we actually have measurements of the muscle to see if the stem cell group has increased muscle growth versus the placebo group.
So that's a measurable thing.
Absolutely.
Yeah.
Absolutely.
Dr. Maliver, let's talk a little bit about that follow-up and how a study is eventually determined to have been a success in something that is going to be applied in a more extensive way. This is phase 3. Are there other phases which must come after this?
Actually, I was incorrect in saying phase 3. It is a phase 2. So after completion of the phase 2, it will go to a phase 3. Phase 3 is pre-marketing. And, Indiana is not the only site doing this research. We have a very good company. The other places doing the research are Yale University, Mass General, Irvine, and Johns Hopkins. So those are the 4 others. The 5th is Indiana Regional Medical Center. And what this does is gives our small community a chance to have the type of therapy that you can normally only find in large cities with large hospitals. So it was a big plus for our region. We're not going to know the results of the phase 2 study probably for another year. As the patients are blinded, we're blinded as well. So somewhere in about a year from now, we're expecting to get the results. And based on the results they've had in Europe and the Orient, we fully expect that this will go on to a phase 3 study. The phase 3 study will be fairly similar, although there'll be a lot more patients being done and there'll be a lot more centers doing the research.
Yeah, and therefore there will be a lot more numbers and cases that can be studied to find out.
Phase 2 really, one of the objects of phase 2 is to prove that there's no harm, and to help prove that it's working. And we fully expect that we're gonna be able to show that.
Companies can end up taking routes that they never really envisioned. Take me back to the beginning of Antria and what your vision was for it. And is this part of what that vision was, or is this a whole new road?
Well, we started out making our own stem cell product, and we're still in that arena. We've got several patents now and several processes that we are working with. We did not plan on going to the site management organization realm, but it's kind of dovetailed into what we're doing because we were running our own studies, so it just came natural to run studies for other companies that are doing stem cells. So it was not what we planned, but it seems to be a natural extension of what we're doing.
Yeah, and it's a pretty exciting extension, isn't it?
Gives us an opportunity to look at what other companies are doing and how they're going about working with stem cells and how they're procuring them.
Dr. Trale, let's talk about what your vision is when you began this process with Antria in this particular procedure. I'm sure that you sort of got an idea that, by golly, there are some other applications that could come from this. This could be a real game changer.
Sure. Initially, when you're going into surgery, you really don't think about it until you walk out of the operating room afterwards, and it dawns on you that, hey, I just did a historical procedure here. We were the first in the country to perform this particular procedure for this study. Mm-hmm. And as Dr. Maliver mentioned before, there's some big players involved in this study. Certainly, if you have an application where the stem cells are successful in increasing a patient's function after the surgery and reducing their recovery time, there are going to be other places that you can use it.
Yeah, certainly. Now, this was an 83-year-old male patient. Think about where it might apply in the future. Automatically, when I read this and was reading about the procedure, I thought Bo Jackson. And I don't know that this applies in that way, but you probably do have an idea. Is that the sort of thing that we're talking about 10, 15 years down the road?
The possibility certainly exists. I think that initially the application is going to be for reducing morbidity and mortality in post-operative hip patients, and other patients too. This may become the norm for many orthopedic surgery applications. We do hip replacements, shoulder replacements, knee replacements, and they all involve some sort of insult to the muscle, which you can't avoid. Now, some approaches are less damaging to the muscle than others, but we need to do these studies in order to determine whether or not this is going to be something that's going to decrease patients' recovery time.
Dr. Maliver, down the road, where do you see Antria going after this, with this and in other avenues?
So we're looking at using our mesenchymal-derived stem cells, which are derived from the same patient's own fat, and we're also looking to use them for orthopedic procedures. Perhaps the next one will be for arthritis. We're also looking to use these stem cells to help cure and treat chronic wounds that won't heal on their own. Those are the next two things we have on Antria's plate as our own products. As far as running studies for other companies, it's really up to your imagination, up to who gets the funding, and what needs to be done.
Is that a pretty competitive world?
It's becoming competitive. Up until recently, there were a lot of what they call the Wild West of stem cells. Some people were just using stem cells without any supervision. I think more and more the Office of the Inspector General is starting to clamp down and making sure that any company involved in stem cell work is using the FDA and following FDA guidelines. What's happened in the past and some of the bad press that stem cells have received has been from companies that went out on their own, didn't follow FDA procedures, and got themselves into trouble.
How would someone become a patient in the study themselves?
For the study we're doing now for the broken hips, they need to break a hip. Okay. That would be the first thing.
Don't go out and try to do that.
No, but as far as the chronic wound healing, our wound center at Indiana Regional Medical Center is willing to work with us. The problem right now is that we don't have funding, so it'll be a self-funded study, and that's really been the biggest impediment. We do have a cost that we have to take care of, and that's the biggest impediment.
Yeah. Well, it's just a fascinating journey, I'm sure, for you and for you, Dr. Trale, as well, just to see where this takes us. But I know it's not a first step. It's the first step that we've taken just as the public hearing about it. But for you folks, you've been involved in a while, and we're going to follow along and see where you go. Thanks for coming in this morning.
Thanks for having us. It's been great.
It is the voice of Indiana County, WCCS, AM 1160 and 101.1 FM.